Okay, I said in the first half my name was Chris. I also said at the end of the first half I'm a nurse. I'm now going to say a little bit more about myself. I have been working with MSF for some years on a variety of projects, but mainly primary healthcare, which has meant that I've also worked in Sudan, including Darfur and South Sudan. And to be honest, if you work for MSF, you are going to end up at some point in either Sudan or South Sudan, because the organization really needs to be in these two countries, as you saw earlier. I've also been involved, however, in HIV programs, and it's HIV that I would like to talk about this evening. So I'm going to take us from Africa to Southeast Asia and to Cambodia. Cambodia, a beautiful country, now a major tourist destination, and I'm sure some of you know that because you've been there. Back in the 1990s and the early part of this century, it was facing with trepidation the pandemic of HIV, human immunodeficiency virus, which is having devastating effects, not only in Cambodia, but in many, many countries across the world. And I was working there as a nursing activity manager, so the same as Anita and also Unity. I was working in a referral hospital in southern Cambodia in the province of Takeo in capacity building, training the staff, working for the Ministry of Health, and volunteers in caring for people with HIV. And in our program, we had 2,200 people, including 420 children. And it's on children I want to focus this evening, and particularly on one little girl, an 8-year-old girl called Bopa. Bopa, a lovely name to say, a lovely name to hear, and it means flower. However, when I first encountered Bopa, she was in a very critical condition. She just had a diagnosis of HIV. She was severely malnourished. She had lost about 1/3 of her body weight. She had terrible fungal infections in her mouth, so it's difficult for her to eat and to drink. She had a very noticeable and very troubling rash all over her body, which you couldn't avoid by looking at her. And if that wasn't enough, she also had tuberculosis. And tuberculosis is the #1 killer for people having HIV. And the staff, understandably, were very, very concerned about her. But before talking more about Bopa, I'd like to take one step back and talk a little bit more about HIV in Cambodia. HIV was transmitted mainly by men having contacts with commercial sex workers, often in karaoke parlors. And karaoke parlors in Cambodia are very different to karaoke bars here in the UK. A completely different meaning is involved. They would become infected, they would take it back to their partners at home. And for children, well, some children became infected from contaminated blood transfusions, maybe from having reused unclean needles used on them in health centers, but the vast majority were infected through their mothers, tragically, during pregnancy, birth, or maybe subsequently during breastfeeding. And without any kind of medical intervention, between 15 and 45% of all children in contact with HIV like that will develop HIV. And a really shocking statistic for you, then and now, only half of children infected like this will reach their 2nd birthday. So truly a troubling situation with HIV and with children, and it continues to this day. This is still, MSF has been involved with MSF for many years, but our big priority still continues very much with children. Now, in that time, in the beginning of the 21st century, let's jump forwards 100 years, the country was still recovering from the disastrous years of the Khmer Rouge in the 1970s, and the health system was functioning, but only really managing with day-to-day health issues. There was no way it could think about implementing a massively costly and complicated HIV program. The same as all other low and middle income countries in that time. And MSF was very cognizant of this problem, and it realized that something had to be done urgently to address it. And MSF, since the early years of this century, has been involved in many countries supporting health ministries to establish HIV programs. During my years working with HIV, MSF was assisting in 24 countries. Initially, we were involved in supporting treatments for something called opportunistic infections. And these are infections that in most cases are easily manageable. However, if you have HIV, which is destroying the immune system, it's not easy to treat them, and they can get more and more serious. And so in the end, they overwhelm that person, and it can lead to death. And Bopa, she had tuberculosis, she had that fungal infection in her mouth. These are just two examples of the many, many opportunistic infections that people of HIV can suffer from. And at the beginning of this century, there were many voices arguing that in countries like Cambodia, let's stop with the treatment for opportunistic infections. There was another treatment available, newly introduced, ARVs, antiretroviral therapy, and these are crucial in not only slowing down the destruction of the health system, of the immune system by HIV, but also reversing it and restoring it, meaning that people don't actually suffer from these opportunistic infections. But they said no. Why? Well, they were concerned that poor countries like Cambodia simply couldn't afford to keep tens of thousands of their population in treatment for life. And they also argued that Cambodia is mainly an agrarian economy. And they said that, well, the people, they wouldn't understand how to take this very complicated treatment. I mean, they can't even tell the time. And it's really essential to take your medicines at the exact times with HIV. Otherwise, you're going to get resistance developing, making already a very bad situation much, much worse. However, MSF could not accept that people were denied access to life-saving care, especially when in Europe, for example, in America, that treatment was available. So, in 2000, they started two small pilot programs in Thailand and Cameroon, gradually extending these programs into South Africa, Uganda, and Malawi, to show that it was feasible and highly effective to treat people in low-income countries. And in 2002, they launched a program in Cambodia. And in 2002, it costs for one person for 1 year $10,000 to treat HIV. At a time when per capita spending on the health system was $20 a person. And I think that illustrates just how clearly why it was so absolutely crucial for MSF and international funding organizations to jump in. And to jump forwards in time, I would like to say that after that time, MSF has been very involved with activist groups across the world trying to bring the price of ARV drugs down. Now, you might be pleased to know that it costs less than $50 a year for the first-line treatment. Now, with this ARV, Bopa, who was really, basically she had a death sentence when she had that diagnosis, after 6 months, no tuberculosis, no fungus in the mouth. She could eat and drink normally. She was what we'll call a bonny little girl. That rash was still there, but it wasn't troubling her, and it's less noticeable. And most importantly, she was lively, animated, full of life. And she was an example of what ARVs can do. Giving hope. Letting a child like Bopa lead a long, normal, and healthy life. And not only was MSF instrumental in giving so many people the chance of a normal life like the rest of us, it did something else of profound significance. Because a few years before, without ARVs, children such as Bopa would be instantly recognizable as having a serious disease. You couldn't escape it looking at her. I mean, she looked skeletal. She really looked tragic. And in her community, as in communities across Cambodia, children with HIV were facing enormous stigmatization. And it was so difficult to hear the stories, the many stories that they told. I used to feel so emotional. Sometimes, I mean, I'm very typically English. I'm I think, quite a cold person in many ways, but I felt tears welling up in my eyes when I heard their stories. These children, often they were looked after by their grandparents because sadly their parents had died shortly before the ARVs were introduced. If they weren't with grandparents, maybe they were with aunties and uncles, but often in these families they weren't always so welcome, and they weren't allowed, in many cases, to sit at the same table at mealtime, not to play with the children. Outside, neighbours wouldn't let their children play with these children for fear, unfounded fear of contamination. And in school, many teachers used to make the children sit apart. So I used to try and imagine what it's like for these children, and it was impossible. I shouldn't have tried to make that attempt. How could I imagine? These children, unless they had siblings, were friendless, often parentless and friendless, and nothing to look forward to. So it's no surprise that many children, particularly the older ones, often used to think about taking their own lives and needed a lot of intensive counselling. But now it was possible to see that they could have normal lives like their peers. And this was transformative. They could go on and think about an education, having a job in the future, having children of their own. And society, in just a few years, seeing that these children could have a normal life, it stopped shunning them. In just a few precious years, and I'm talking just 4 or 5 years, the communities opened up and accepted children like Bopa. Think back to UK. In the 1980s and 1990s, the first decade of this century, incredible stigmatization. It's only in the last few years, the last decade or so, that people have been coming out on television or in newspapers and talking about having HIV. But there, in resource-poor Cambodia, where people said these people don't have much of an education, 4 or 5 years, people were opening up and treating these children as if there was nothing wrong with them, because there was nothing wrong with them. We had been able to show that HIV, okay, it's a disease, but it's just like so many other chronic diseases. It needs medicine, but there's so many diseases where you have to take medicine every day. It's no different to that. And the trajectory of that transformation, when I think back to my time in Cambodia, it still never ceases to amaze me. And I think it's no better illustrated than on World AIDS Day, which falls, as I'm sure many of you know, on the 1st of December, when people come together to remember all those who are sadly no longer with us, but also the achievements in new treatments, in new diagnostics, and also to think about the people who are still living, because there are 38 million people now living with HIV. 38 million. And on World AIDS Day in Cambodia, our local MSF staff, our national staff, they organized for the children an outing for the countryside, culminating in a picnic by the seaside. Now, that might not sound like very much, nothing out of the ordinary. But if you went back 2 or 3 years, that would have been accounted impossible, because no child would want to be identified as having HIV, and no family would let them go on an outing like that. And these children were quite happy, proud to wear T-shirts, talking about HIV. So anybody seeing them could identify these children as having HIV, but it didn't matter anymore. It was an amazing day for me to observe. It was also amazing to see Bopa seeing the sea for the first time in her life and paddling in it. That was also something that can stay, will, not can, it will stay with me for many years to come. HIV clearly has no cure, not yet. Maybe in the future, who knows, but not yet. I think it's still a long way off. But it can be controlled, and it could be controlled very, very effectively. And MSF was instrumental, not just in Cambodia, but in many countries across the world to show how easy it was to do that. And jumping forwards again, you might be interested to know that just in 2021, MSF was directly treating just under 40,000 people for HIV and indirectly supporting their treatment of ARVs for another 50,000. It's always difficult to think in terms of big numbers, yeah? I mean, I get lost with it and I just turn off. But just imagine 90,000. 90,000 is Wembley Stadium packed to capacity. And not only did we help save so many lives, but also MSF, coming to the theme of this evening, MSF helped to heal that awful stigmatization that previously had led so many children and could have led Bopa too to living a life of hiding, of fear and misery. But now Bopa, like so many children in Cambodia, so many children across the world, can play freely with friends. They can go to school happily, not sitting in the corner, and they can look forward to a future of expectation and happiness, just as all children have a right to do. Thank you very much. And now, yes, if I turn around, just a few photographs. Many of our children came from very poor families. HIV, often in these countries, it's very much an illness of poverty. Not necessarily, but it often can be. And that's a very typical household that I used to visit. Okay, the next picture. Okay, other very simple houses. For us, looking quite romantic. Maybe we would like to live there, but the conditions, I can tell you, are very difficult. I actually lived just opposite here, but I lived in a nice stone building. Yeah? It was a little bit different with my own bathroom. Yeah? Here, a little bit different. And when the waters rose, then it was a very difficult life for people. Okay, next picture, please. Okay, this is on the outing, going through the communities where these children lived. Clearly, a few years ago, nobody would have done that. Yeah? I also took lots of photographs of the children at the seaside, but because it identifies them directly, we felt it better not to show here. But I took those photographs to give to the children to take home, and they were so happy with them. But even this photograph, you can see there was no hiding there, no hiding at all. Yeah, next picture. Okay, this is Priang Vey, our pharmacist. I wish I was as organized as he was, yeah, when sorting out drugs. Okay, in this cupboard, okay, we don't have ARVs here, but the top drugs here are for tuberculosis. As I said, the biggest killer of people with HIV. Underneath, we've got antibiotics and other drugs. And at the bottom, in the red containers, that's milk powder, yeah, which we gave to mothers so they didn't have to breastfeed and transmit the virus onto their babies. Okay, and I think there was one more picture, or maybe it wasn't, maybe not. Okay, anyway, I had one more picture very quickly. In that hospital, MSF built a 2-story clinic. Yeah? It was a big investment, but it was important because that's where it's able for us to help train the Ministry of Health staff. And when we left, that clinic, of course, is still there now after many years, and it's being used as an HIV clinic. So it's not just about training and supplying drugs, transforming society. It's also, in many places, you know, giving clinics, giving space for people to be diagnosed and treated in. Okay, and I think that's more than enough for me for talking. Now, well, I have to talk more if you have any questions for me, maybe, but now I'm going to let some of you do some talking with your questions.